So this is my mom. Her name is Jessica Anderson Riddell.
Hi,
And what is your profession?
I am a family nurse practitioner.
Why did you pursue this profession?
Well, I pursued this profession. When I was 2 years old, my mom used to basically brainwash me, telling me I was going to be a nurse. And then when I was 10, my mom would take me to see her nurse practitioner. And from 10 on, I said I was going to be a nurse practitioner.
Okay. What is the difference between you, a nurse practitioner, and any other nurse?
Myself, as a family nurse practitioner, I'm considered what's called an advanced registered nurse practitioner. I have a master's degree, and I went to a specialized family nurse practitioner program where I did clinical hours actually seeing and diagnosing and treating patients. A nurse, there's registered nurse who has between a 2 and a 4 year degree, and there's also LPN, licensed practical nurse, that has 1 year degree. Nurses, RNs, or LPNs cannot diagnose and treat. Like an advanced registered nurse practitioner, I actually diagnose and treat.
Okay, so you're able to prescribe?
I do prescribe. I actually prescribe per Florida law. I can prescribe all medications, and it was just passed as of January 2017 that we will be able to prescribe all medications, including scheduled, controlled narcotics. So that is the case in most all of the states, but Florida and one other state, we were not allowed to prescribe controlled substances now until January 2017. So it's a great thing for nurse practitioners.
So can you describe marijuana?
Can I describe marijuana?
No, prescribe.
Oh, can I prescribe marijuana? I don't know the details regarding that quite yet. I don't think anybody does.
Oh, okay. Okay. So what age did you earn your degree?
I became a RN first at the age of 24, and I then worked for 2 to 3 years as a registered nurse in critical care. I then went on to get my master's degree, and I began seeing my first patient as an advanced registered nurse practitioner at the age of 30.
Okay. What was it like to see your first patient?
Well, I began my career in the medical field when I was 15, and I became a candy striper. So to be honest with you, I went from being a candy striper at 15 to a nurse's aide at 17 to an LPN at 20 to an RN at 24, 25, right in that bracket, and then a nurse practitioner at the age of 30. So my first patient was long ago. So when I first started seeing patients as a nurse practitioner, it was what I had been doing all these years, so it was no big deal.
Okay. What practices have you worked in, and what practice would you recommend working in?
Well, I worked in, as a nurse practitioner, I worked in urology for 5 years. I then went on to family practice for a year, and now I've been in urgent care setting for 2 years. It all depends if what you like. There's many different specialties that you can be in, and there's benefits and drawbacks to each place that you decide to work.
Okay. Did you have children while you were in school?
Yes, I had my tailor from beginning to end.
And would you say that it made it more difficult, or did you have a supportive family?
No, I had a very supportive family, and it actually gave me the drive to become a nurse practitioner. I needed to take care of her and my family, so it's quite easy.
Okay. Do you believe that the medical field is paramount career choice compared to other options?
Absolutely. A nurse practitioner PA is the #1 job in the United States, and it's projected to be the #1 for quite some time. And I absolutely love my profession, and I would recommend it to anybody. It's wonderful.
All right. Finally, what advice would you give an aspiring nurse or nurse practitioner?
Just love your job. Work hard, study, stick to it. Keep your head held up. It's hard work, but whoever wants to do it, you can do it. It's well worth it.
Okay, thank you.
Yeah, no problem.